We're going to pop a little Robert Jones bandage on Porthos, who's going to be our kind volunteer today. So we have all our bandaging equipment to begin with. We've got our bandage scissors, some normal scissors, our orthopedic padding, conforming gauze, and our vet wrap or rip wrap, which is a self-adhesive outer layer tape that'll keep it all held on together for us. All right, so before we start bandaging, we make sure my hair's tied back, I've got a scrub top on, and I'm wearing some gloves because we never know the state of an animal when we're touching it to avoid infection or disease spreadage. So when we begin our bandaging, we begin at the toes, and we want to make sure that our wrap, as we're unrolling it, sits like a snail. I know, good boy. So to begin with, we start underneath the foot and we come over the top. We do a neat little fold and then come round the sides, making sure that now we've enclosed the little booty and our little toes are closed. We can then use our snail to firmly, but not too tightly, wrap our leg. Once we hit the point where we're happy, we've covered the area that we need to, we can go back down just to add a little bit more padding and a little bit more stiffness to our bandage because we don't want the leg to be able to bend too much. And this will also help secure our toes. Because Porthos is such a large dog, we can continue until we use the whole bandage just for extra padding. Or we could stop and remove at any point. So we've got our nice soft padding layer on now. We then want to get our conforming gauze. So this is nice and stretchy. And this is what's going to help apply pressure to the area now that we've got it all nicely padded. So same deal, starting over the toes, nice run forward. I've done this one the opposite direction to the previous one. All of these bandaging materials will come in various sizes. So this is a little 5 centimetre wrap. They will come in 7.5 and 10 centimetres as well. So if we did need to bandage a large dog like Porthos, it would be easier to be able to use one of the wider bandages, so I didn't have to roll quite as much. So I've gone up the leg and then back down, keeping my little snail section nice and handy. So we've got, at this point, it's always worth checking, we're not too tight around our toes and we are not too tight around the top. We then repeat with our outer layer. So I'll try and do this one this way round for you. So from the back, across to the top, little fold, and then around. This one is a little harder to use because it's sticking to itself while it's rolled up. So we can see that I've let go and it hasn't unraveled like all the others. So you may find it easier if you pull a section out and then briefly re-roll it. So as I'm unwrapping now, there's not as much strength for me to have to pull to get it to sit. Doing it this way also means I can guarantee the tightness of what is getting applied to Porthos's paw. Whereas if I just kept rolling, that is quite tight in comparison. Once we reach the top, we're going to stop, and it is rip wrap because we can just rip it, or we can use some scissors to cut it. We can see here now that his foot is nicely contained. If he were to get up and walk, as a greyhound, he would likely tell me that I have broken his leg, but they do very much get used to having a bandage. When we went to remove the bandage, we have two options of how to do it. The gold standard option is to simply unwrap exactly what we just did. So he's come in for a bandage change. We're going to unwrap everything we just did. Once you get to the little toe section, it normally just pulls off quite easily. If we were worried that this had stuck, we may want to use some bandages to aid the removal, or if it was an emergency and I needed to get in here really quickly, I wouldn't be going for my normal scissors. I would definitely be going for my special bandage scissors, because the worst thing I could do to Porthos would be to cut him while I'm trying to take his bandage off. So these guys have the little rubber knob on the end that I could slide in underneath to cut my way through. I don't like cutting unless I absolutely have to, because there is always that risk of me cutting into the patient, particularly if you don't know what else is underneath the bandage. You don't want to cut into anything important. For instance, if you were working in a vet clinic, there might be an IV catheter underneath this bandage that I wasn't aware of, and I do definitely not want to cut out a catheter that is sitting right into his vein, and if I cut through that, that's leaving some little bit of plastic inside him that we would then need to go and get. So I always strongly advise, where possible, unwinding the bandage. If he was going to have his bandage on for a very long time, some other things we could do is get some cotton wool, like this bandaging material, wad it up, and we could pop it in between his toes. And this just stops his toes from sitting next to each other and getting all sweaty and gross. So we would pop some in between every toe, making sure underneath that we're also going to cover to make sure we're protecting rubbing and moisture from forming against that bottom paw. Once we have done all our toes, we definitely cannot forget our little dew claw friend up the top here. So he gets a little bit as well. And then we would just apply our bandages exactly the same way that we did just before. This just stops the prevention of what I affectionately refer to as toe jam. And if you've ever had a broken arm and had your splint off afterwards, you know how nasty that smells. So we don't want this on our little furry friends either.